My name is Dr. Ombati, Timothy Mokua. I'm the CEC. I'm in charge of health services in Nyamira County. And I want to say that health is the backbone. Because without health, people cannot be able to go to their shambas, people cannot be able to produce anything in terms of business and all these other things. And therefore, our effort to make our health work in our county, Nyamira, is an effort towards the right direction. And as His Excellency the Governor, Amos Nyaribo, came into power, one of the areas he insisted that has to work is health. And it's something that I've put a lot of effort together with my team in the office to make sure that we do the much we can and make sure that our people receive the services that they need. And with that, I can say that in the 6 pillars of health, where we have infrastructure, where we have human resource, and actually human resource is the center of everything, where we have technology, that is information technology, where we have supply of medicines, and all these other areas we are doing at the optimum level, and we want to try and do better. And I want to welcome you to have a journey with us. You look at how we've started, what we have done, and what we are doing to make sure that we revolutionize health in Nyamira County and bring it to a level where we are going to work closely and make sure that our people receive the best of service. We are talking of health financing, where our people are doing a lot of out of pocket. But we want to make sure that most of our people, in greater percentages, go into insurance. And actually with the primary health care, this is the direction that we are taking. Like now, what we are talking about. We have casuals who have not been paid for a period, others to a period of 35 months, others 18 months, the lowest being 2 months, arrears. I'm proudly announcing before you that today the payment started. Probably started around Friday last week, and it's been continuing, and the last person will receive their monies by Friday, end of this week. And that is a great achievement that we've had. Not only that, many other achievements that we've had infrastructure-wise. Our county referral hospital being revamped to better status. The Keroka facility very soon, which is becoming a better facility, and probably request for an upgrade to a county referral hospital. So these are some of the areas that we are touching on to make sure that our health and the people receive the care. And so I want to welcome you to a series, to a journey where health has been and where we are headed. And I know you love the transformation that we have received in matters health. Thank you.